She cannot urinate. Or the room will come small and stop. Telling you that it's a problem. You should come. And you know something? Before prostate or breast cancer reach 1 centimeter in size, it has must been there for like 2 or 3 years. That's what what the literature was saying.
It actually takes
time before it appears. So that's why you need to be very careful.
Oh, wow.
Yes. So that's for prostate cancer, and there is also abdominal or pelvic pain or back pain, chronic back pain. Or maybe you are seeing urine, you are seeing blood in your urine too. You need to come. That might be the early sign of the prostate cancer. While for the colorectal cancer, maybe it comes in form of what do you call it, pile. Maybe everything is pile, you know, hemorrhoid, basal. It might not be basal. It might be early sign of cancer.
Okay.
And maybe there is change in habit. Maybe he cannot be able to pass the toilet for one week. And you know, he's experiencing abnormality. Maybe sometime if he's passing stool, there is a blood stain in it. It could be any sign of colorectal cancer. So these are some of the signs and symptoms that people should watch out for. Then they should present at the hospital so that a clinician can examine them, give them some tests, and so that we know exactly what is happening. You know, in cancer, we don't ask. Early detection saves lives. Early detection is the key. Early detection saves lives. So that is why you need to watch out for these symptoms or signs and symptoms. Yeah.
All right, thank you. All right, so moving ahead, the rule of genetics. You've said something about genetic cancer already before, but I would like you to explain more. Yeah, you said someone could have cancer not because due to factor, how did you even call it? But due to genetics, coming from your family or whatever. Yes, so
hereditary.
Yes. So how important is genetic testing in assessing cancer risks, especially for cancer like ovarian cancer and prostate cancer? Who should consider it?
Well, for genetic testing, you know, cancer is a genetic problem. It happens in the cell, and in the cell it happens usually inside the DNA of the cell, and that is the genetic makeup of individual cell, DNA. So the arrangement in the DNA, there's what we call helical strand, how the arrangement in the DNA are. So if there is mixed up in the arrangement, there are some special proteins. Special proteins, they are arranged in such a way that they must follow sequence. So if there is any disruption in those sequence, that is actually going to affect the DNA generally. So genetic testing is a device on individual who has high chances of developing cancer. Who are those? If there is family history of breast cancer, if there is family history of ovarian cancer, if there is family history of prostate cancer, we ask you to go and do genetic testing. For example, there's what we call BRCA1 and BRCA2 mutation. Mutation is an abnormality that happens on the gene that I had earlier mentioned. So if there is the misarrangement, you know, there is sequence. Let's say A should pair with B and C should pair with D. And now in the arrangement, A just pair with D. Is it normal? It's not a normal arrangement.
There's a problem.
So exactly what is happening in cancer. That is what we call mutation. So and if you allow that mutation to continue and enter into another cycle of division, so you end up having cells that are mutated, replicating. And if you are replicating the mutated cells, that's what can lead them to become radical cells. They will not listen to that strict rules that the body set up because the arrangement has been misplaced. So now they become bandit, they become, they become terrorists
in the body,
criminals in the body, because They are internal made of, is different from the normal sequencing that they're supposed to have. And that can lead to that mutation. So people that are having BRCA1 and 2 mutation, they have high chances of developing breast cancer in their lifetime. So we ask them to come and do genetic testing so that we should know if they have that gene, the BRCA1 and 2 gene
in their family.
In them.
Okay.
If we ask you to go and do genetic, if there is a history of family history, so we ask you, you don't have breast cancer, but we ask you to come and do genetics testing. And if we conduct the testing and we find you have the BRCA1 and 2 gene, we advise you, madam, there is high chances for you to develop breast cancer in the future. Therefore, we advise you to there is some advancement. Actually, the scientists change the sequencing, but now sometimes we ask you to do what we call bilateral breast mastectomy, where we should remove that breast completely, then and reconstruct another breast for you that might not develop breast cancer in the future. So that is actually the importance of genetic testing. It's just trying to screen, early screening, and to check whether there is high chances of you to develop breast cancer in the future. So that is the importance of genetic testing, and it can only be done or advised in people whose family has history of cancer.
You know, you talked about constructing another breast that will not cause you trouble, will not get affected by cancer. So I'm just wondering, because you said earlier on that for me to be a woman, it is another high risk factor of becoming a cancer patient, breast cancer patient. So it just came to my mind, so why can't all of the women
remove their breast?
You just give us another breast that will not carry cancer. No?
A woman with that breast, the psychological...
We use formula to feed our babies, Abby.
But formula might not be enough, of course. Formula, you have to breastfeed your child. And breastfeeding itself is also a form of preventive measures of developing breast cancer. So that is why it's very important to call out for those women that they feel breastfeeding is just, it's all practice.
Yeah, they say, their breast will suck. They don't want their breast.
It's not sucked, do not change anything, because as you aged, age will catch you.
Yeah, the breast
you will eventually suck. And it is man that you are actually want to preserve the breast for. That is not the psychology of a man. Psychology of a man is not actually your body metal. It's something else.
Something else.
Yes, you understand, you agree with me. Somebody's wife will be more beautiful than his girlfriend, but he will keep spending on the girlfriend.
Voila.
So you see, the mind is different. So it's better you breastfeed your child. There are some ingredients in the breast milk that you cannot find inside the formula. That bonding you are seeing between the mother and the child is only when you breastfeed your child that you should be able to see that bond.
It's true.
It's a natural thing that God made it in such a way that people should be able to recognize actually. So that is it.
Alright, so moving ahead, advance in treatment, after contacting cancer or after developing cancer or you self-develop cancer. Yes, because you cannot just wake up one night, you want to develop cancer now. Yourself just feel like, okay, let me become a terrorist, let me become let me just give you headache. So now advance in treatment. How have innovations like immunotherapy, targeted therapy, and precision medicine change treatment outcomes compared to traditional chemotherapy?
Okay, in everything, in medicine, there is always advancement, because day in, day out, research is ongoing. Even the traditional chemotherapy that we are giving now, the rate at which the chemotherapy is given is getting reduced with the advancement of the modern, treatment method. Okay. In cancer treatment, there are 3 modalities in cancer treatment.
Okay.
And these 3 modalities involve, number 1, surgery. And surgery.
Yeah.
The process of cutting some part or whole or part of the body. Number 2 is chemotherapy. Number 3 is radiation therapy. We explain surgery. Everybody knows surgery. Chemotherapy is a method of cancer treatment in which cytotoxic drugs, they are special chemicals, special drugs, we call them cytotoxics. Why cytotoxic? Because they kill cells. They kill cells, both the cancer cells and normal body cells. Those drugs can kill them. Yes. So we call them cytotoxic drugs. It's a special formula that we give to target the cancer cells, but in targeting the cancer cells, they also injure the normal cells, but they kill the more the innocent cells, or they get them weakened, some to the extent that they even die. That is why if you are giving chemotherapy, you see an individual will also be having some very serious side effects. For example, vomiting, diarrhea, loss of appetite, even hair loss. You see the hair, the loss of that. This simply because cancer cells, as I earlier mentioned, they get divided and replicate very rapid without even getting maturity. And the most rapid growing normal cells in the body is our hair cells. You know, when you bob your head 2-3 years, you see them regrowing again. Yes. They are fast. So now the drug is targeting any cells that is rapidly dividing and replicating. So that is why the reason why if you are giving chemotherapy, you find out as they are killing cancer cells, they are destroying our hair cells. Just that after the treatment cycles, the hairs will start regrowing again. But they come with kind of complication. I have complete black hair, but if I undergo, it's either brown or grey. That to tell you how the side effect of the cytotoxics are. So now with the advancement in medicine, now we have targeted therapy, we have immunotherapy. Immunotherapy is just like, it's another modality under like chemotherapy. It's a special injection we give. But now immunity, we all human beings, we have immunity in our system. Now what is the function of immunity? Is to protect the body from diseases, from infections, from any external or internal problem. So it's now just like soldiers in the body. They protect our body. So now immunotherapy is made in such a way that now we want to recruit, we want to teach our immunity to identify cancer cells and kill them inside our body. Okay. Yes, now
this one is better.
It's better, but it's more expensive. Oh. Yes, it's more expensive. It's just that we recruit, we change their pattern, we change their mindset, our immunity, that these are the signs. If you see this kind of cells, just kill them. So it's now the body immune system that will be killing the cancer cells. It's less side effect, but it's more expensive. It's an advancement in the treatment. Are you following? Yeah. Then that is for the immunotherapy. It's special drugs, very expensive, and it's not easy to access.
The common man cannot access
actually. Then we have targeted therapy. Okay. Targeted therapy is another form of chemotherapy in which now the cancer cells, they have certain proteins on the cells, on the surface of the cells. Okay. Special proteins on them. For example, we have, for people with lung cancers, there is what we call EGFR. Epidermal growth factor receptor. Epidermal growth factor receptor. People with lung cancers. So now, that protein is the one responsible for the cellular growth, division, and survival normally. So if cancer cells in normal cells then if cancer cells also have that EGFR on them, meaning it's going to help the cancer cells to replicate, divide, and keep growing. Yes, reproducing again in the presence of that EGFR protein. So now in targeted therapy, we identify this one, they have the EGFR on them. So we develop a special drugs, call it targeted therapy. We give so that the drug we are going to give is going to be EGFR inhibitor. It's going to go and cover that protein so that it will slow or even stop the growing of the abnormal cells in cancer treatment. Are you following?
I'm following.
So that is now the inhibitor of the EGFR, for example. But for the breast, there is some molecular types of breast cancer, we'll call it HER2. Okay. In breast cancer alone, there is some molecular division. We have lumina A, lumina B, triple negative, HER2. So that HER2, human epidermal growth factor receptor on the breast, and for every 4 patients with breast cancer, 3 of them must be HER2. And the drug we use, for example, Haske-Tv, is a targeted therapy, but it's very expensive, costing not less than 1 million naira. Haske-Tv is very, is very, very, costly in the market, even to how it works. So that is how the targeted therapy, it targets those cancer cells with that special protein, so that when they see them, they go and cover them, so that it will disallow the cancer cells from replicating
and from growing.
Just like they are the one foiling the growth of the cancer cell.
Yes,
now you remove you stop the source of the foil.
Yes.
You get it?
That's
exactly that's exactly what is happening in targeted therapy.
All right. Thank you, Mr. Jamilu. All right, at this moment we are going on a very short break. When we return, the program will continue. Don't go. Alright, welcome back from that short break. If you're just joining us, this is Weekends with Rachel Langs on Haske-Tv. And of course, I am the Rachel Langs, and with me here. Alright, so we've been talking about cancer, the silent killer. Alright, he have actually said a lot, and then we are going to continue from where we stopped. Alright, so now when you hear this personalized medication or medicine, we often hear the term personalized cancer treatment. What does that actually mean in clinical practice? Personalized.
Well, actually, this question is more of should be more of the expert in cancer care. But for the benefit of this personalized care or personalized treatment is an advancement also in cancer care, in which the tumor sequencing of an individual. Somebody is diagnosed with cancer. Now we want to look at the arrangement in the cancer, the sequencing in the cancers diagnosed. So the biomarkers of that particular cancer can be taken, make some laboratory research, and come out with a specific treatment peculiar to that particular person, not applying to Mr. B, just specifically for that person.
Just one person.
That is why it's personalized. It's a kind of an advancement treatment modality in cancer care.
Just for one person.
Yes, just for one person.
Yes. All right, now so you've talked about treatment, side effects of treatment that could actually cause loss of hairs, and some are very expensive, some are kind of have a lot of side effects. So now, managing side effects and quality of life. How do modern oncology practice address long-term side effects and improve quality of life during and after treatment?
Well, as I mentioned, in medicine, all drugs that we are given, they have their own side effects. side effects are normal, unavoidable, presentation after undergoing a treatment, or if you are undergoing any treatment, any drug, or most drugs they have their own. Even these anti-malarial drugs, when you start taking them, you feel like sometimes it will change the taste of your mouth, sometimes it will weaken you. These are side effects. And there's what we call adverse effect. They are the unwanted side effects. So in cancer treatment, most side effects these drugs come, especially the chemotherapy, which they have many side effects. Is most of them they come with alopecia. Alopecia is the removal of one's hair while receiving chemotherapy. You see that all their hair, is gone.
Gone off.
Loss of appetite, vomiting, diarrhea, general body weakness, tiredness, lethargy. Somebody will not be even, sometimes even to the extent what we call chemo brain. Their concentration ability has declined or reduced because of the side effect of these drugs. So in cancer care, our aim is not actually to just to treat you and go. We will support you through this journey. We help educate you, we support you psychologically, we make patients that survive cancer, support groups, so that you encourage one another. We make sure those side effects are well addressed. If you are having vomiting, we ensure that we give you drugs even before the chemotherapy starts. In chemotherapy there is drugs that are not chemo drugs but are pre-medications. If you want to give you chemo today, there are some drugs will give you 30 minutes injections inside IV fluid. It must be there because to reduce the side effect.
Oh, okay.
Yes, sometimes once you start this chemo, you will vomit like 20, 30, 40 times.
In a day?
In a day. So imagine somebody vomiting 20 times. It's going to lose a lot of fluid in the body, leading to another problem, body fluid imbalance, a lot of problems. So we have to give you those drugs so that to mask that side effect of drugs. Pre-medication first, then after the chemo, we'll give you another post-medication just to mask the side effect. Sometimes we can even give you drugs, oral drugs that you go home be taking. All what we are doing, and we encourage you to be taking too much of water. Water is paramount in cancer care because these drugs we are giving you, they are very toxic, they are cytotoxic, so you have to be washing them. Otherwise, if they are too much in the system, they are causing another problem to the cells. So that's why you, especially the kidneys, so that you will be taking water so that you should be flushing those chemicals and dead cells and everything so that it keeps. So the support we give in modern oncology care is that we support patients that are having this side effect. We support them physically, we support them psychologically, we support them spiritually out of that, so to be sure that even after treatment we keep supporting them. So that's why the modern treatment or oncology care, you have to also take care of that side effect of the drugs. Yes.
All right, so I don't know this one though. The future of cancer research. Yeah. What should I continue? Or?
You can continue, or maybe the next one, because it's one of sequencing and.
All right, so let me just skip this one. Okay, so I guess our time is actually against us. Time is actually against us, and I'm sure that time is eyeing us right now. Yes. So, in your own view or in your own words, what are the advice you will give to our viewers out there? Those that are actually going through these trials, probably cancer patients, and those that are probably aftermath of the treatments, the side effects, and those that probably they don't like checking their body. Just as you said, for a woman, you need to be checking your breast, you need to be checking your body to be sure that you are intact and you're okay, so that it will not take you unaware that actually you have been living with cancer and that you don't know.
Okay. Well, thank you very much. Globally, about 10 million people died of cancer each year. 10 million people die of cancer each year. And this figure is increasing. And this is more than HIV and AIDS, malaria, tuberculosis combined. So cancer mortality is more than these 3 diseases I mentioned. And 1/3 of these cancers, 1/3 of these cancers can be prevented, are preventable. Another 1/3 can be cured completely if detected early and proper treatment is rendered. So early detection is the key. Early detection saves life. People should be watchful of their body. If you see anything new, either on your breast or in your health generally, please
just go to hospital.
Go to hospital. Go to the right hospital. Go to the right hospital. See the right person to see you, not just anybody. And if you are in Taraba State, we ask you either to go to FMC Jalingo or go to Specialist Hospital Jalingo, or even go to Farmers Cancer Foundation Jalingo, where there are experts that can be able to clinically attend to you and make some diagnosis of cancer for you. So that is number 1. Number 2, from the theme of the World Cancer Day 2026 is United by Unity. For those people that are suffering of cancer, it shouldn't be left, not them just face the problem alone. There should be support from the family. You know, it's not easy. The cancer treatment is very costly, and the health system is very, very complex, that everything is not easy financially, and there is high financial toxicity in people nowadays. People doesn't have money. Just to diagnose cancer, you are spending a lot of money. Now if they make diagnosis, they want to start the treatment. For each cycle of chemotherapy, they'll be calling you 100,000, 120, 150, and you need to do this after every 3 weeks for the cycle of 8 cycles. That is one part. They'll come to surgery. After surgery, they want to send you to go and do radiotherapy somewhere. We don't have to. So there is some disparities in cancer treatment where some people do not have access to this facility. There are financial problem. There is inaccessibility to these healthcare infrastructures. They are not enough. Look at Taraba. It's only when you come to FMC Jalingo or probably Wgwr, you'll be able to access some of the cancer treatment. Otherwise, you have to travel to Gombe, to Juth, to Maiduguri, to Abuja, to Zaria. Somebody going from Jalingo to Kano, off to Zaria, off to Gombe. Look at the logistics, the risk. He is tied already with the disease. Now he has to carry this road. It's not easy.
It's not.
So that is when we want to call the attention of the government also to look at the citizens of Taraba State. Let's make it possible. Let's have this diagnosis available for the Tarabans. Let's have this health cancer care, cancer diagnostic machines and infrastructures. Let's have this expert available so that our people, our brothers and sisters can get treated here in Taraba State. Yes. If somebody is diagnosed with cancer where he lives in Gembu, let's say Zangu Achia, on Dumiyaji, a border to Cameroon, before somebody to reach Gembu from Dumiyaji, it in like 2 hours on a bike. There is no motor road. Imagine it's a Taraban. He lives in Dumiyaji and she diagnosed with cancer or she diagnosed with cervical cancer, bleeding. They give all the drugs to stop bleeding, it's not stopping because it's cancer. Just imagine how they travel to Gembu, then from Gembu coming down to. So there should be evenly distribution to this accessibility of cancer care. Let's have it, let's say even at the local government level, where there are trained experts that can be able to see this patient and refer them early why they should get care. So that is why we call the attention of the government and as well as philanthropists. They can have access. Not necessarily that the government must do everything. We have rich people that can say, what do you need? We need radiotherapy machine. We need CT machine scanning. We need MRI machine. We don't have one. And he has the money. He can donate one for us. Or you can reach to other philanthropists somewhere, nationally or internationally, so that we can get availability of this machine, so that our people can be easily diagnosed and get treated. So that is actually my word. And for our locals, for our people at home, anytime you see something, please rush to hospital, come and see expert, so that you can be diagnosed early, detect early, and you get treated early. Mark you, some cancers, they even have vaccine. We didn't talk about it. For example, cervical cancer, there is vaccine for cervical cancer.
Really?
There is screening for cervical cancer, there is vaccine for cervical cancer. It shows that there's no time that we cannot elaborate about it. There is
okay, there is vaccine for cancer.
For some cancers.
Some cancers. Alright, I guess this one will be a side talk. We're out of time. Alright, so this is where we draw our curtain close on this beautiful episode. We can just with Rachel Langs on Haske-Tv. And of course, I'm that Rachel Langs and
Nosi Yayawa Jamilu.
Alright, so we are saying have a beautiful evening and stay tuned to our subsequent programs. Don't go anywhere. Happy viewing. Bye.